It is estimated that in South Africa, 5.6 million people were living with HIV and AIDS at the end of 2008. This is an average of 12% of the population and 20% of adults in the age group 20 to 64. South Africa has a higher number of people living with the disease compared to any other country in the world. Sadly, the infection rate has not shown a decrease over the years. An average of 1,000 people die every day from AIDS, and 60% of government hospitals are filled with HIV and AIDS patients. By 2015, some 5.7 million, or 32% of all children, will have lost one or both their parents to AIDS. HIV attacks the immune system, and specifically the CD4 cells in the human body. There are 4 stages to the disease, and if an individual finds out their HIV status at an early stage, they are able to treat and manage the disease and live a relatively normal life.
Now I'm leading a happy, normal life. I'm living a positive life.
HIV is transmitted through sexual contact, heterosexual, which is the most common in South Africa, as well as homosexual. Transmission may take place during a blood transfusion, however, this is not common. It can also be transmitted from a mother to her child during pregnancy, but if the mother knows her status and manages the HIV virus in her body, she can prevent that infection into her child. Although there is no cure for HIV and AIDS, over the years it has become an exceptionally well-managed illness. Through healthy eating and a healthy lifestyle, the deterioration of the body to the AIDS stage can be prevented for up to 20 years or even more. With treatment, the lifespan of someone living with AIDS is increased substantially. In 2001, Atlas Copco South Africa identified that HIV and AIDS has the potential to affect its business and the employees and their families, and therefore embarked on a mission to reduce the impact and manage the effects within their company. A policy was implemented, and in 2002, education was offered to every employee within Atlas Copco. Knowledge around the subject was poor. However, so the best starting point was to empower people with knowledge so that they could make better life choices. By 2003, the response had been so positive that the company decided to offer free voluntary counseling and testing, so every employee would have the opportunity to know their HIV status. The response exceeded all management's expectations. Over 95% of employees within Atlas Copco South Africa had an HIV test. Due to the testing and accurate prevalence rates of the infection within the group, the company was able to evaluate the cost of treatment, and it became a reality. During 2004, a disease management program was launched, and free treatment was made available and accessible to all employees as well as their spouses. The program offered ongoing counseling and support, blood tests, doctor's consultations, antiretroviral treatment, as well as vitamins. In 2005, the Swedish Workplace HIV/AIDS program, or SWAP, was born in South Africa. Atlas Copco was invited to participate due to its experience and knowledge of what it had achieved over the previous 3 years. SWAP initiated and now co-funds long-term HIV/AIDS programs in workplaces in sub-Saharan Africa. The organization's partnership with Swedish companies has opened the door to sharing experiences and developing programs to ensure that HIV and AIDS has minimum impact on business. The monitoring tools implemented have assisted with assessing the success and evaluation of the program. Atlas Copco supports its companies in developing HIV/AIDS programs in countries where there is a need, in Africa and elsewhere. Knowledge and experience of such programs are transferred between Atlas Copco countries and across geographical borders. Successful programs require commitment from the entire organization, from management to employees. However, it is critical that managers are visible in their participation. Atlas Copco has continuously been an example to other Swedish companies in its management's leadership. Even during tough financial times, Atlas Copco remained consistent, and it recognizes the program's contribution and its importance to its own long-term sustainability. The Schwab Achievement Award was established in 2008 to encourage and reward successful and innovative workplace initiatives that prevent the spread of HIV and AIDS and decrease the effect of the HIV pandemic. In 2009 and 2010, Atlas Copco South Africa was recognized for the best and most comprehensive workplace program.